You've made it to Chiro Hustle. Sit back and learn from the greatest influencers in the profession. This week's episode is brought to you by Clothes for Chiro, Posture Screen, Chiro Thin, Imaging Services, Zingit Solutions, Chiro Moguls, Rhino Coaching, Local Gold, Dr. Peter Goldman's Zone School of Healing, Go Get Talks, Mahalo Wellness, 5-Star Management, The Goodman Factor, Chiro Health USA, and Fit to Lift. Let's hustle.
Hey guys, welcome to episode 123 of Chiro Hustle. I'm your co-host Luke. Here's your host, Jim.
So today we had the opportunity of interviewing Dr. Mitch Mally. If you want to understand that chiropractic does treating and adjusting and hear from an extremity specialist, stay tuned for this episode. So Dr. Mitch Mally, this is episode 123 of the Chiro Hustle podcast. And first question we ask everybody is, tell us your chiropractic story and what influenced you to become a chiropractor.
That's a great question. Well, I actually sustained an injury before attempting tryouts for the Detroit Lions or the Tigers to my left knee. I was a collegiate athlete, and I was also going to try to become an orthopedic surgeon or a neurosurgeon in my pre-med program. Having been 3 courses shy going to med school, or a week before tryouts, I blew every ligament and cartilage in my left knee in a high-speed pivot, and it was a 2-hand touch game that my brothers put on in honor of me turning pro. I said I wasn't going to do it. I can't take a risk of injury. Come on, you're the fastest and strongest out here. I said, no way, no way. Okay, fine. I'll make one debut. First play of the game, history has occurred as a result. I tore every ligament cartilage in my left knee on a kickoff return, and I went to a chiropractor who was on the field, took my knee that was dislocated, relocated it, and said, hey, before you have surgery, come and see me. Let's see what we can do to prepare you for the best outcome. So shy of 3 courses going back toward med school, I decided at that point this guy's help was so incredible. And watching people 5 days a week for 6 weeks leaving a chiropractic office, not the way they walked in, that is for the better. And it absolutely was blowing my mind. And my 2 older brothers are biochemists and immunologists, PhDs and masters. So the last thing I would ever think about doing was chiropractic. It was quackery in our profession. In our family. Having a medical family, technically you would think about going on to become an orthopedic surgeon or neurosurgeon if you're not going to play pro ball. Lo and behold, I ended up going to this chiropractor 5 days a week, 6 weeks. I was back to weightlifting, sprinting, and decided to change my career right there on the spot. I enrolled into chiropractic college in Davenport, 1978, graduated in 81, took the only 3 courses in sports injuries. Now, mind you, in that day, you only needed 2 years of pre-chiropractic or undergrad. I had 4, and I was assisting in autopsies in Detroit at the very world-famous William Beaumont Hospital. I have quite an extensive medical background in international kidney disease research, et cetera, lots of mouthful. But the good news is it led me on a journey that I am today so very grateful for the contribution I've been able to enjoy feeling better and contribute to our profession, giving my skills, having experienced injuries, and now treating those injuries.
You have a very extensive bio. I love it. So can you tell us a couple things that maybe make you unique in the chiropractic world? Or what are some things you might have gotten to do that most other chiropractors haven't?
Yeah, that's really a nice question, Luke. I actually have had a very wonderful career of about almost 40 years, graduating beginning of 1982. So literally almost 4 decades of care. But, being an injured athlete and understanding athletics, and the only thing I could do with my upbringing was medical. It was involving drugs or surgery or splinting and laying off it and icing. And then you tape it and you go back and play on those minor injuries. I also have a 50-year martial art background. So I've competed and done all kinds of martial arts in my upbringing. Wow. And in 7th grade, I broke my right arm all the way in half. Both bones were hanging out of the skin, folded it over backwards. And you know what? It's just incredible that nobody ever looked at the fact that I landed on my wrist that affected my arm and that it would have compressed into my shoulder. So as I became a chiropractor and started looking for biomechanics and physics for all these injuries, I could relate many of these injuries to myself. So when I take care of an athlete's elbow, I look at their wrist because it's the wrist that's throwing that curveball. It's the hand that hit the impact at the ground. It's your wrist that's using the tennis racket and the golf club. So with the millions of people suffering elbow complaints, you must look at the whole system, the kinetic chain. For example, most elbow problems I've corrected by manipulation of the wrist. And it's fascinating. I can get into the extensive neurology and biomechanics, but I don't want to bore you. I'll just tell you right now that my office is in a surgical pavilion, 3 medical pavilions, and I have the only chiropractic wellness center among all surgeons. So my integrative background, working with medical doctors and surgeons. Today, I sent a patient that's here from Florida. I called my surgeon buddy next door, orthopedist. I said, do me a favor. I've got a patient here with a bone-on-bone left foot at the where the shin meets the foot. It's called the talotibial joint. So we took x-rays. I called him up. I said, do me a favor. Could you consult her regarding arthroplasty, either fusion or a replaced joint? He said, you know what? For you, doc, I'll work her in. So on the first day of the week of a guy you can't get in for 2 to 3 months, we have a great integrative working relationship. And he went ahead and saw and consulted this patient that's here in my office for 3 to 4 days from Florida. So it's really it's been a wonderful journey. And the second half of your question was, what else did I learn? Well, I've had the opportunity to treat many celebrities, world-class professional Olympic athletes, people I never would have met. I have toured the world teaching anywhere between 50 to 60 events a year and full-time practice. So it's just been an amazing roller coaster of fun, enjoyment, thrills of helping humanity.
I don't know if it's a violation of HIPAA or anything like that, but would you be able to share any names of celebrities or athletes you've taken care of in the past?
Well, my wall of fame is 3 walls full, so I can tell you that Lou Ferrigno, the Incredible Hulk, I've treated Lou for 39 years. He's one of my closest male friends on earth, and he just adores me and my wife for all these years. We talk often via text and emails, jokes and little things because you're buddy. But he also, I should let you know, as he walked my wife down the aisle, we're that close. So that's one. Roger Craig, the very famous pro football player for Joe Montana, the 49ers, were under chiropractic care because I trained Dr. Nick Athens, one of my students in San Francisco, who I needed to refer Roger because I simply couldn't keep going back and forth to San Francisco and Davenport and everywhere they went. I just couldn't do that. So my student, Dr. Nick Athens, studied under me, and I referred Roger and told Roger, whatever you need. If you ever have a problem, and I told Dr. Athens, if you have a complicated, difficult case, let me know. The Tennessee Titans flew me out twice to their facility because the chiropractor said, I know one guy who is equipped with the expertise that could help us with these conditions. Because he wasn't trained in my field of expertise, he was able to provide the necessary spinal care. But when it comes to very difficult, complicated cases, my office is kind of like a Mayo Clinic for chiropractic. We have patients from all over the world, from Israel, from Germany. We've had people from Norway and Denmark and so on and so forth. And it's just exciting because we all put our pants on the same way. I just choose to zip mine from the front.
That's good.
Well, as you say that you've helped, world-class athletes and famous people, I think that's pretty cool because I grew up in Davenport, Iowa, and on your bio, it says that you did work with the Quad City Mallards and the Quad City Thunder and the Quad City River Bandits, and that being my old stomping grounds, that's a pretty prestigious position as well, working with those minor league athletes.
It is. In fact, if you remember the CBA with Jimmy King of the Fab Five of University of Michigan, remember? Jimmy King, one of those Quad City Thunder, tremendous stars. And LeBradford Smith, you remember LA came down on an ankle on somebody else's foot, the typical common injury in basketball, rolling that foot and ankle. The surgeon takes him back to the room, to the training room. I go back there, he checks, he says, well, I don't think it's broken. And the surgeon said, you're done, team doctor, and I'm the team chiropractor. And I said to him, I said, LeBradford, it's Sunday. I said, you're going to be out. This guy says 6 to 8 weeks. Next week is the All-Star game. You need to play Wednesday. I'll get you out there and get you playing Wednesday. He goes, what? And the surgeon turns and looks at me and says, impossible. Well, LeBradford, it was on Sunday, came over to my office on Monday. We x-rayed him. I did my fancy procedures I've developed, the Mally method. LeBradford Smith played Wednesday. He played in the All-Star game, and it was just a beautiful thing. So, you know, take an expensive athlete today. And Jason Worth, famous baseball player that I took care of years ago. And, you know, you take a look at these athletes, and they're paid some serious money, a lot more than I'll ever earn, right? But to get this person back out on the field, the court, whatever it is, just realize what that means to the team. When you see Kevin Durant with his recent injury, that should have and could have potentially been helped by manipulation of his foot, which changes the angle of the heel, which is that which attaches your what? Achilles tendon to your calf and your hamstrings. Well, had that procedure of mine been implemented, like in Lou Ferrigno, they wanted to cut his Achilles tendon years ago, cut and scrape along the fibrotic tissue. Well, Lou told me, and this is public knowledge, by the way, this is all not HIPAA, this is actually written in print, and he claimed that I saved his career and his ability to run and jump and so on and so forth. Then the beautiful thing is it was just his heel, the calcaneus, which was misaligned, pulling on his Achilles tendon, and that creates a mechanical shift that pulls on that tendon, and eventually the tendon is just kind of like a violin string. The more you pull it and turn that keg or peg, and pretty soon it's tight. If you go a little further, it snaps. That's like the Achilles tendon or a bicep tendon or any other muscle injury. So it's been exciting to treat these guys, and most of them are down-to-earth, humble giants, and these pro basketball players that are flying in and out here all the time, PGA, LPGA players that come in and out. It's just been an absolute godsend.
Something funny I just wanted to touch on really quick. You and Jim having parallels with the Quad Cities. So you studied in Detroit, Michigan. That's also where I went to college.
Is that right?
Yeah.
At Wayne State?
No, I went to the College for Creative Studies by the DIA.
Oh, you're one of those brainiac guys. I was just a dumb jock.
Did you ever go to the two Coney Islands right next door to each other?
Oh, I've been to Coney Island, of course. You can't go to Detroit and not go to Coney Island.
Did you have a favorite one?
No. Food was food back in Detroit
That's
until you got to Greektown.
So do you have any favorite motivational quotes or words of wisdom that you live by every day?
Yeah, you know, optimism. Did you know that optimists live much longer than pessimists? That's absolutely fact. If you say the word love and you say the word hate, just roll it off your tongue. You'll actually feel and hear the difference in your tone. Love has a high vibration. Hate has a low vibration. Low vibration is actually linked to disease. Most diseases have what's called a low vibration. Love, spiritual, godliness, holiness, etc. have very high vibration. When you talk about the mind, Louise Hay, one of the brilliant authors, wrote the book, You Can Heal Your Life. And when you read some of the amazing work that she's done and the work of Dr. Wayne Dyer, there's some incredible artistic wording and verbiage. My mission statement sums it all up for me. Helping others help others. And to me, that just 4 words that are so powerful. My wife is a brilliant marketer, and she came up with the when I asked for a trademark, a title, if you would, who is Dr. Mitch Mally? She said, it's very simple. You bridge the gap between pain and performance. Because think about who I see, the painful, the injured, and those that want to recover and perform, and those who are healthy who just want to perform, like a race car going around the track. She says, you are a one-man pit crew for the human body. And I said, that's quite fair and accurate.
So I know that when I first heard about you, this is a story about me a lot of people might not know, but I injured myself playing high school football at Davenport Central.
Okay.
And my mom took me over to Palmer College of Chiropractic to get x-rays on my spine and my shoulder. And I remember your name from being 16 years old from the Palmer campus, that you were like the guy that worked with extremities.
Wow. Are you 21 now then?
Exactly. He's 41 in October, actually.
You know, it's interesting. The funny thing about that is chiropractic used to be illegal on campus when I was going through as a student. It was only in my final year that it became legal. The funniest part about it was faculty would bring me in the room privately to treat their patients and themselves. So I always had a student with me, you know, just to protect me.
And I know that you said something earlier in our interview called the Mally method, and I know that you are the extremity guy. I don't know if there's anybody else out there in the chiropractic world that has such a detailed history as yours as being the extremity guy. Let's talk about the Mally method a little bit and how you got to this point where you are right now with your career and helping athletes and high performance people with their extremities.
Well, I would like to go spiritual for a moment and tell you not enough people praise the Lord and say, thank you, God, for the great gifts that you've given me. And I want to tell you that is by far the change in my life. Was one cliche that you asked me, Luke. I'm going to give you this one. People plan and God laughs. And I want you to think of your own lives, what destiny you thought you were going to have and how it may have completely become something different than you thought. I never dreamed of chiropractic. And now that I have, people are all saying to me, Dr. Mally, why don't you go ahead and just become the orthopedic surgeon, neurosurgeon, and get the respect? And I said, it's quite eloquent. I said very simply, I said, it's more fun for me to talk to the orthopedic surgeons and neurosurgeons from the level of biomechanics and physiology that they haven't had the in-depth. And I have 18 clinical residents that provide me from 54 medical journals from all over the world every month. Each of those 18 interns have to give me 3 abstracts of research that supports everything that I found in the human body. So when a surgeon says something to me, I just say, are you familiar with the Journal of Bone and Joint Surgery, Journal of Hand Surgery, Castelli, Evans, Perez, Armstrong, and Silverstein et al.? Are you familiar with Ewan Farrell's article on, so on and so forth? And I cite the article reference, the page number, all of it, because I got one of those weird brains. I had a football helmet that actually had a lot of padding, and thank goodness I haven't lost my memory due to the many concussions. So I have one of those very strange minds that loves to read. Now, if you ask me to read science fiction, I'll fall asleep after the table of contents. But you give me research articles, and it relates to the human body and I can understand it, it is just mind-blowing. So surgeons no longer really like to entertain the thoughts of maligning our profession in front of me. You know, years ago, Jim and Luke, you talked about Detroit. I was invited to represent the profession to speak at General Motors years ago on cumulative trauma disorders to a group of somewhere between 200 and 300 doctors from all over the country and Canada. And I just lit that place up like a Christmas tree, having fun, explaining what it is that I do in a non-surgical way. And this is the best part. On my exit to the airport, they had a limo, and they had 6 of the surgeons ask if they could go in the limo, I think maybe just to make sure I got the heck out of Dodge. But they asked me all kinds of questions and said it was fascinating. They've never heard anything like this. And those are the receptive few that we hope to become many as we can work together on an integrative way for you, the patient, to get the optimal results. You asked one other sentence. I'll leave this sentence as hopefully one of the last cliches. But for the listening audience that are actual professionals, doctors, and I really live by this. I never worry about income. I want you to worry about outcome. Outcomes generate income. If a doctor is listening to this is struggling, or a student going to get into practice, worry not for the earnings, prepare with the learnings. Start with outcomes and you'll never worry about another bill.
Honestly, that's why Luke and I work so hard and we just produce so much content, because the outcome is the status that we've achieved. And it wasn't just because I was like, hey, Luke, let's try to do something small. I was like, no, we're going to do this rapidly, and we're going to do 600 interviews in 2 years. And that's what we've done. And that's really the genesis of Chiro Hustle, is we just kept on outpacing people and outworking people. And the outcome is today we get to talk to you.
Well, let me tell you, let me give you a shout out to your listening audiences. Luke, Jim, you guys, and Chiro Hustle, you guys are the greats. You're bringing this information as a conduit to the public and to the professionals through the outstanding questions and heartfelt things that you are saying. And I want to add one other thing to what you asked me before was, what is one of those things that really makes me stand out or what have you? And I'm sitting here letting my gray matter work for a little bit and try to think about it. And I'm going to tell you what one of my patients asked me today, which came out of the clear blue. And I was very quickly, mathematically, went with a low number. The question was, Dr. Mally, you're almost 40 years, including residency or internship at the school, not including students and seminar weekends. About how many bones do you think you've moved in these number of almost 4 decades? I will tell you unequivocally that I will tell you if the average person was just 10 bones in the entire human body, that's all I did, you're somewhere around 10 million bones being moved. And that doesn't include seminars. In October of 2011 at Parker Seminars in Las Vegas, my wife collects these little releases that every student and doctor has to sign for me to treat them. And I treated 278 people in 4.5 hours, just one body part. I never want to do that again, guys. Luke, it about killed me. I was miserable for a week, but all those doctors were excited. They felt great. So it's very taxing because what we do might be physically, guys, but what we do mentally and emotionally, dealing with sickness and disease and people coming in with cancers and told they've got 3 months to live. One of my glioblastoma cases, which is the size of a fist tumor behind his skull in his brain, was told by a doctor he has 3 months to live. That was over 18 months ago because the patient said, Jesus knows better. And this patient said, I will defeat this. And so far, every 30 days, they do a complete brain scan and it's not changed size. It's an absolute, like your shirt says, Jim, for the audience, expect miracles and pray for them. I certainly enjoy this quite a bit. And I'll tell you what, there's so much to say, so I'll let you do the talking now.
Well, one of the things that really touched me there is I get a lot of opportunities to speak to chiropractors now. And I get, phone calls and messages from leaders that are non-DCs like Dave Major and Keith Wasung, and they reach out to me. And whenever I get a chance to go on stage now and present to a group of chiropractors, I always thank God, number one, and I always thank my team, number two. And I always tell people that without my team and without God, I'm just another guy. And I love the fact that you recognize that as well, as God sets the plan for us. We just get a chance to participate.
Absolutely. It's very, very, very well said. People plan and God laughs. Just keep that open line as a conduit and don't wait until it's too late to say, oh, please, God, help me. Where were you before? You should have been talking to him for a long time. Luke.
So what do you think it would look like if more chiropractors started utilizing your techniques and, followed everything that you've been researching? How would that change the profession?
Well, we've been observing that because when I was asked to speak at the NFL Combine, the NFL chiropractors, and pro sport for the rodeo, and SEPA for the pro baseball players, and the NHL, when I've been asked to train these people, I've been able to see that these doctors, if they would continue using and practicing the techniques to the cliche I give them, which is make a decision for precision. Learn the techniques. Look, why is there only one sniper in a battalion of 1,000 people? It's because they have the dream, the desire, the dedication, the determination, and the drive, and the ambition to be the best that they could possibly be. Why is it we have to be content with mediocrity? If you were in junior varsity and wanted to play varsity, you wouldn't be content sitting on the bench. If you're varsity and you wanted to beat out the two guys ahead of you, you're going to go out there and you're going to compete harder. You're going to train harder. You're going to train more, and you're going to do things after practice, before practice, to become the very, very best. You know, when you look at the rungs of ladder of life, most important thing is, yes, it might be an effort to put 1 foot up, and you may have to use your upper body a little bit, but you know what? The rewards are infinitesimal because you continue growing by leaps and bounds. And don't ever stop. My ladder continues to get taller and taller as I go up the ladder closer to my maker. I'm just doing what he's asking me to do, serve.
Well, I have a question for you. You touched on a couple fence posts, or the fence words, treating and manipulating. I know that's dogmatic in the chiropractic world when they build their languaging. How would you approach somebody that says, hey, we don't treat anything and we don't manipulate?
You know, a very good philosophical question. I just spoke at a philosophy class on Friday night in Kansas City. And to be perfectly honest, when I was in Norway, I spoke to a group and they were arguing between vitalism and mechanism. Are we doing more vitalistic, meaning letting the body do what it's got to do? Or are we more mechanistic? And it was a heated argument, just like straights and mixers, and just like you've asked as well. You know, I don't get caught up in the petty. Some people say manipulation. Well, you're manipulating somebody's mind. Another person says, well, you're just an insurance adjuster. If you're adjusting, what are you, insurance adjusting? This is the inside fighting that I have a personal issue with and I have no time for. There are patients in my office waiting to be seen and treated. Do you think they would enjoy knowing there's such infighting and political differences in a profession that's the fastest growing healthcare profession in the world, and they can't agree to disagree? My point is very simple. We've got enough of a message to go out there and serve the world, help people, treat people, or manipulate or adjust people, but do it with chiropractic. It's funny, the same people that argue are the people that banish the definition chiropractic, which means done by hand, not used to be done by hand. So when people now go off and all they want to do is all these adjunctive therapies, when you come and follow me around the different conferences and conventions every weekend, you watch and see all the vendors with every imaginable device, and you watch and see who's got the line of people who are waiting. And what are these doctors waiting for? A good, old-fashioned, very precise adjustment that Dr. Mitch Mally is known for. A precise, sniper-specific adjustment to restore function. They've been taped, they've been wrapped, they've been massaged, they've had rehab, all of which we do in my office. But the one most important point that we cannot forget is we have the greatest profession in the world of bloodless orthopedics, bloodless neurosurgery. We have the greatest neuromusculoskeletal specialty in the world that encompasses nutrition, exercise. Remember I said about emotional and mental and physical part of our practice? Well, the mental and emotional part is because you're dealing with people who don't understand what you do, and you're trying to help them understand a healthier way, a healthier lifestyle, and a bright 100-year plus lifestyle that hopefully they'll all live to see. Anti-aging through adjustments and proper clinical nutrition.
I really wish that more doctors also did not have time to get into such debates with each other. So
It doesn't serve us well.
But where do you see chiropractic heading in the next 20 years the way it is right now?
Is that including your former question or excluding your former question? Because the growth of anything, if you want to grow a tree, a fruitful tree, you have to nourish it. You don't take the roots and start pulling one way and pulling another way and expect a fruitful tree to develop. The backbone of our profession needs everybody to be in agreement and support with one another so we can grow collectively, cohesively, and make this profession what it should have been all along. A one united chiropractic association with minds of people wanting to preserve and move forward from our ancestors to a future that is brighter than any, the future of becoming the gatekeeper, excluding fractures and surgeries. We as chiropractors are trained with over 200 more hours than a medical student when they graduate med school. These are known facts. Our amount of radiology is extensive in our training. And this is, again, a very important thing to do because not to see is to guess. And there are chiropractors who don't x-ray. And I truly I don't understand that because I wouldn't go to a blind brain surgeon or a blind heart surgeon. And for our profession, politically, I think we need to stand together and stay with the merits of what was created way back September 18, 1895. In the Royal Surgeons of England in 1840 to 1860, it was published in 1860. The Royal Surgeons of England, Dr. John Hilton, MD, a neurosurgeon who found that one limb was shorter than its contralateral fellow. What he said was he would take a stack of brochures and stick them underneath the short leg until there was a want of symmetry of both shoulders. That's a neurosurgeon, 1840 to 1860. Chiropractic wasn't birthed until 1895, September 18, 1895 in Davenport, Iowa. So long before chiropractic even evolved, you've got a neurosurgeon that found that low back problems, sciatica, hip problems, etc., were because one limb was shorter than the other. I've now gone to somewhere between 6,000 and 7,000 studies that I've done. And you gentlemen and the listening audience, if you have your own joints, that means hips and knees, you have between a 90 to 92% probability one of your two legs is shorter than the other. Why is that important? Because when you get off the chiropractic table and you walk to the front desk, how long are you going to hold your adjustment if one leg is truly shorter than the other? So the Mally method, we created a protocol and a program which we can do as a very specialized x-ray and the analysis and the training that goes with it so that every chiropractic school in the world can have the students prepared to go out and practice with a consistency and continuity of care, an ability to measure every single patient. And when you had a knee and hip replacement, that number goes to 99.9%. Isn't that fascinating? The patient survived surgery. The joint is perfect. The surgeon says, I'm done. Well, those patients end up in our office, Luke, Jim. They end up in our office, and we have to evaluate them why their back is hurting. And the gentleman that was in today, one of these six new patients today, one came up, two from Florida, and this gentleman was wearing a 20 millimeter insole inside his shoe. He said, that is my leg length deformity. I said, sir, how's that working for you? You're complaining about left knee, left hip, and low back pain. How's that been working for you? He says, well, I know my hips feel perfectly balanced. I'm here to get fixed. I said, good, let me do my job. You're actually 32 millimeters. He says, that's impossible. So he said, would you re-x-ray me wearing my shoes with the 20 millimeters? Guys, do the math, 20 to 32. What do you think the difference was on the x-ray? 12 millimeters. He says, okay, doc, you're right. I asked him if he could teach my wife those two words.
You've made it to Chiro Hustle. Sit back and learn from the greatest influencers in the profession. This week's episode is brought to you by Clothes for Chiro, Posture Screen, Chiro Thin, Imaging Services, Zingit Solutions, Chiro Moguls, Rhino Coaching, Local Gold, Dr. Peter Goldman's Zone School of Healing, Go Get Talks, Mahalo Wellness, 5-Star Management, The Goodman Factor, Chiro Health USA, and Fit to Lift. Let's hustle.
I know chiropractic was based on science, philosophy, and art and research. And I'm going to get into that question real quick with you. But first thing is whenever I go out, and something that a lot of people probably know about me is I went out and I did a ton of chiropractic screening events, and I scheduled in a ton of people for chiropractic visits. And I always told people that chiropractors help you with certain things, but you should have 2 doctors in your life. You should have one to keep you healthy and one to save you from dying. And I tell people that it's a 2-doctor system, that if you don't take the advice from the chiropractor, you're taking advice from people selling you the other stuff. And you can have that if you want to, but if you want to have that word they used earlier, vitalism, if you want to have a vitalism core, then you have to go see the chiropractor. And there's certain parts about what the chiropractor provides to the patient that no other profession can do. That's why I stood out there toe-to-toe with society, scheduling people in like in 3 minutes. Like I can go out there and meet somebody right now and schedule them into your office in 3 minutes, and they'll show up at a 70% clip because of the way that I tell people what you do, what you don't do, what they're going to experience on their first visit, what they're going to experience on their second visit, and how they can expect to be treated by you. So when we get clear on what we say to somebody that's expecting, like you're saying, this guy comes in and tries to, qualify whether or not this heel lift is working. Well, the chiropractic adjustment always works. And I always do the Sid Williams to people too. I grab the keys out of my pocket and it's like, I don't believe in chiropractic. I go, chiropractic is just like gravity. It works whether you believe it or not. You don't have to have a belief system in chiropractic because it's a healing art system. It's not a belief system.
But I need to hire you, buddy. You know what? It's really, it goes much more beyond adjustments, manipulation, the Mally method of manual medicine. Guys, this is what we're dealing with is not only the nervous system, but every cell, tissue, gland, muscle, and organ of the body receives the message from the brain down the spinal cord and out to every single blood vessel, etc. So when we think about, let's talk about last year, how many surgeries? 750,000 gallbladder surgeries last year, 719,000 knee replacements last year, 600,000 low back surgeries, 500,000 carpal tunnel surgeries, 332,000 hip replacements, 250,000 shoulder surgeries. I don't call those problems, I call those opportunity. The public needs to know alternative approaches, but the issue is the fact that we don't have a constant, consistent continuity among our profession. People try many, there's over 300 different types of procedures in our profession. So if something's not working, the doctor shouldn't tell them to go to surgery, refer them to a specialist in our profession, inside our profession, inside referrals. Just because you can't help them doesn't mean there isn't people out there who can. I have chiropractors, funny, only 2 of them in the entire Quad Cities, more chiropractors per capita right here in the Quad Cities than anywhere probably, and only 2 that refer to me on a consistent basis. Everybody else attempts to treat everything themselves, and that's wonderful until the patient doesn't get better. If the patient's not getting any better, look, go to the sniper. That's who every king, every queen, every politician, who is it really the one that protects them the most? Not the street cop. It's the one you don't see. It's the sniper who gets the job done. So I have a plea for all of the doctors and students. If you want to learn sniper-specific techniques of the spine, the cervicals, the jaw, the entire extremity system, shoulder, elbow, wrist, the 23 entrapments from the shoulder down to your hands, 17 from your elbow to your fingers, 17 entrapments from your leg, from the hip down to your toes. If you want to learn these and become a future leading extremity and spinal expert in your community, learn how to take care of the patients using the Mally method of nearly 4 decades and over 10 million adjustments. That's a lot of adjustments. That's a lot of experience and many cases that we can talk about.
Well, really quickly, before Jim or I ask the next question, I just want to do a little Chiro Hustle shout out. Brandy Morgan is watching, and she says, thank you for sharing your wisdom.
Thank you, Brandy. I appreciate that. Thank you.
And for me, the next question is it's not scripted, but what do you think is the most important thing to happen to chiropractic in the past decade?
I think the exposure of professional athletes coming out, making the claims, like Tom Brady, stating how chiropractic has helped him, Jerry Rice of the San Francisco 49ers, how chiropractic has helped him, and the list is countless, guys. More and more, Lou Ferrigno, Roger Craig, Hall of Famers, all these people coming out and saying it, these pro basketball players who I don't have the right to give their name at this point, but these very high level pro basketball players who are going to come forward and stay, I hope they do, how chiropractic has not only helped them stay on the court, prevent injuries, but if an injury occurred, they knew who to turn to help them restore their body biomechanically and get them back on the court faster than any other procedure, barring if anything unnecessary, or necessary, if surgery was needed, then surgery would be performed. There's limitations to everybody. We just ask the public to listen to alternative healthcare approaches. We get calls every day from all over the world of people wanting to come here to Davenport, Iowa, to come to my office because they're learning about this guy that's got like a Mayo Clinic type of neuromusculoskeletal practice. I don't ask for it. We don't advertise, Jim. It would be scary. I don't think I could be here enough hours a day if you were working behind the scenes or in front of the scenes marketing for me, because all my marketing guys, and I know you were going to ask this question, what do you recommend from a marketing standpoint? Best outcomes, best practices. Build the practice of your dream. Worry not about the end result. Reverse engineer from the outcome. Reverse engineer of the problem and how you're going to get rid of that problem in the fewest number of treatments possible. Be a sniper.
Well, if you know of any celebrities or athletes who would like to come on Chiro Hustle, I know we would love to have them.
Interesting. I will definitely post that as a possibility. And the first person I know that, let me just check with them. Let me check with them. And I will certainly, if they authorize and approve it, I would be happy and honored to go ahead and pass the name on with their approval.
Yeah, we just had a big name, Ivan Meisner with BNI agree to doing a Chiro Hustle podcast today.
Awesome.
Yeah.
You guys are the best. You are the greats.
Well, we just show up, and that's a part of it, Showing up's 9/10 of winning. And
absolutely.
The other part is the execution.
Do the work.
And doing the work,
Didn't Wayne Gretzky say it, the famous hockey player? You miss 100% of the shots you never take.
That's one of the that's one of the lines I use when I'm doing the chiropractic screenings. I go out there and I tell people that you miss every shot you don't take. So do I. So that's why people enjoy talking to me, because I'll talk to them and I'll say, hey, if you guys keep walking, I can't help you.
Then the other one you like is go where the puck is going.
Yeah, I always know where the puck is going. And that's why I help people, is because I know that anybody that stops and talks to me, they're not there to ask me anything non-specific other than chiropractic questioning. So I always tell people that if you're in front of me, I know that you have something that you want help with. I'm here to tell you the truth and that I can help you. Now, I'm not going to tell you that I'm going to tell you what's going on with you, but I will tell you that if you come in and see our doc, you can ask them any questions that you have about your health. And the typical doctor visit, I say, you're not going to get an offer like this anywhere else. If you called us up right now, we'd charge you $350 for this offer. I'm giving you this offer to come in and see us because I know that you need our help and we're here to help you.
Outstanding. Absolutely outstanding.
I just harvest the communities and bring people in.
But you can feel your passion and what we call a level of certainty,
Mm.
you know?
And I am the sniper.
Yes, you are. Yes, you are. You talk the talk, buddy.
And I love it because, you'll probably resonate with this. When I got out of school at Marycrest College, I started working for the Quad City Times.
Oh, okay.
That was my first journalistic approach outside of school. And I was writing for the Quad City Times for 2 years. And I realized that everything that was happening to me wasn't what I wanted with my degree. So I went and started framing houses on the bluffs of LeClaire, Iowa, with my college degree after 2 years of working for the newspaper.
Wow.
And then I did some soul searching and I was like, well, what should I do? I was like, well, there's one thing out there that I've believed in since I was 16. And I don't want to go back to school, but I want to support the beautiful profession of chiropractic. And that's really where the genesis happened. About 10 years ago, my good friend Matt Walker invited me to come up and work at his office in Arlington Heights, Illinois. So I went up and I worked with his office in Arlington Heights, Illinois, and learned how to do the doctor's talks, learn how to do lunch and learns, learn how to do community screening events. And that's really how this all happened. But I had to believe in what I was doing. And I stopped believing in sports journalism.
Touche. Interesting. Well, I'll tell you, you speak very eloquently. And I should tell you this. I don't know if you know it yet, but most of the doctors that see us at conventions and conferences, et cetera, and they want to get adjusted, they all keep tagging me with a name. So I went ahead and I just protected the domain, the doctor's doctor. And, they just all want to get adjusted. They come up, they fly up, they spend 3, 4, 5 days here. I see them 3 times a day, but we're making lives of our own profession, starting to seek for sniper specificity. So when they're done with care, they go back into their world, but I ask them one question. Are you ready to sign up on my fellowship program and my training and learn all this? Yeah, I got to look into it. It was self-serving for their own healthcare. And what I'm trying to do is have those doctors themselves be legends in their community and become the expert sniper-specific doctor in their area because the community needs it. The community needs, and you asked a question about the future of chiropractic. I'm going in a roundabout way, and we've talked quite a bit about it. The future is quite bright for chiropractic. We need to arm ourselves with less infighting and less differences and focus on the commonalities, not the differences. We need to have a common voice, a common definition and description of what we do so it's not confusing to the public. I have patients coming in, do you use that little handheld device? Do you do this? Do you do that? I said, we do what is necessary, but most important, if I'm stepping on your foot, does it make sense to tape your foot? Does it make sense to use laser on your foot? How about if I take my foot off of yours? Wouldn't that make a logical sentence? So before we talk about my entire physiotherapy and rehab department and our taping and all the vitamin nutrition and functional medicine, what we do, the most important thing is a triangle. The base of that triangle, that base is anything you want it to be, but the apex of that triangle, the very top of that triangle, has to be the adjustment. Because my staff, everything that they do all day long fills that triangle, and they prepare before I repair. That is the difference. If you don't prepare before repair, then you got despair. And I try to make sure people understand that you've got to work cohesively with the patient, understand their nervous system, understand their habits, understand their exercise or lack of, understand whether or not these people are going in for vitamin B12 shots. They could get on anti-aging. They could do so much for themselves. Did you guys know that when you sleep in the deepest REM sleep possible with GABA and melatonin at the proper script, you guys, do you realize that your pituitary gland releases growth hormone? And your growth, this is your anti-aging formula that's going to actually help you reverse the aging effects of your body. It's a youth body transformation. in addition to that, there's so much we could talk about: nutrition, specific athletic injuries. And if you and the listening audience wants me back, we could do one specifically on shoulder injuries, one on ankle injuries, neck injuries, TMJ. Heck, 60 million Americans suffer TMJ disorders. That is ridiculous, the jaw. So you stop and think about that. And the quote is, erroneous results due to misdiagnosis. So it becomes a battlefield for the practitioner, but it becomes a field of agony, both physically, emotionally, and financially for a patient. People go with TMJ disorders to dentists, and it's the most dangerous, most powerful joint in the human body. And who is the world's finest dealing with TMJ or joints? Is your chiropractor who is highly skilled and trained specifically for how to treat temporomandibular joint disorders, affecting sleep apnea, asthma, things that we've treated, just ridiculous. And I don't want to say the word treated again, because I saw your nostrils flare, Jim. But we work on the nervous system to let the body do what it has to do the way it was God-given, intended to do it. We do these adjustments to restore function and nerve and blood supply to allow the body to promote the necessary healing and live a life that's more drug-free. And it's not that we have abundance in organs, we can spare so many, and we're not deficient in chemicals that we need so many more. It's very simple. You got a pebble in your shoe, let's remove the pebble so your foot heals.
Well, this brings us to our last and favorite question. What do you like to read? What do you listen to? What are your hobbies? And what's your favorite food?
Favorite food. Well, that's why only my headshot is seen at this point. I've got 23 extra pounds of extra food that I shouldn't have on me right now because it's all inflammatory. Well, I'm working on that. I'm a work in progress. And honestly, I think that reading, I will tell you, as I said earlier, I have 54 medical journals, okay, that I get 3 abstracts per month from 18 clinical residents working for me. So I have enough reading of the abstracts and articles in the medical world from everywhere. I mean, in foreign literature. That's where my attention is to my intention. My attention is to my intention to provide the world, while I'm in it, the greatest healthcare possible from somebody who has drive, determination, desire, dream, dedication. That is Dr. Mitch Mally, who's a sniper, who wants to get that pattern when I shoot, hole into hole. When I adjust, I want it to be one absolutely pristine, perfect adjustment that the patient doesn't need to come back, numerous times. They've already had that and it failed. Most chiropractors see patients who've been to other chiropractors and other doctors. But once they find home with you, that specific chiropractor that does something uniquely special for that patient that made a difference, that's their new home. And they will refer more people through word of mouth than anything. Facebook is fine, Instagram is fine, Twitter, LinkedIn, it's all good. But I'll tell you what, I'm old school. These gray hairs will tell you I'm a communicator. I talk the talk. So do you, Jim Chester, and you as well, Luke. You're a high-tech guy. You understand what it's like producing movies. I'm the guy who does the acting real life. There is no act. It's the real thing. You know the best parent in the world is the transparent. Being able to see through what people are feeling, understand their emotions and the psychosis that contributes to their disease, and give that patient the utmost respect as if it was the doctor receiving the adjustment. Treat others the way you want to be treated.
My last question for you. Next time that Luke and I are in the Quad Cities, can we come in and get adjusted?
You know what? I think I just missed you, didn't I? I think our mutual friend told me you were going to be in town and we couldn't connect, Jim, and I apologize for that. My life is not in my hands, so I never know what's going to be, guys. I run by the seat of my pants in an organized fashion, but I don't know what today or tomorrow has to offer.
Us too.
I absolutely understand and can relate. You guys, you come to Davenport, Iowa, and we'll show you our facility. We'll show you what it is that we do unique. And maybe we can even produce one of your shows live right here. That would be fun. That would be exceptional, on site, and that would be fun. So whatever you want.
My favorite thing to do would be do a Facebook Live of you actually adjusting us.
Oh my goodness. Okay, you need a fast shutter speed because these adjustments are super quick. You know what? That way, if I make a mistake, nobody saw it. Just kidding. But no, you know what, guys? I would be happy to, and you know, we'll see what tomorrow has to offer. I hope the listening audience of both students, doctors, and the public enjoy understanding the heartfelt words that I shared with you. And if I've stepped on anybody's toes, please understand I'm an extremity specialist and I can help those as well. I'm honest, I'm integrity-based, I believe in helping others help others. I'm here to help you. You can reach me at the links that you'll share later, and happy to help serve humanity, one patient, one bone at a time.
Could you give us a couple of those links just so people listening now could go check you out if they want?
Sure. The YouTube channel, you would go to all lowercase, B as in boy, I as in India, T as in Thomas, dot, L as in Larry, Y as in yes, / Dr. Mitch, that's Mitch Mally. That's a YouTube channel. You can go ahead and scroll and peruse. Tap the button at the top that says additional or more videos. And that's just a composite of some of our testimonials. And you might enjoy some of those where people's elbow problems were corrected by manipulation or adjusting at the wrist, and where most people's knee, hip, and low back problem, when I corrected their foot or their leg length, corrected their problem that they've been treating 20, 30, 40 years for, and how the TMJ, when corrected, has given a gal with 7 years deafness in the right ear from a car accident. She had come to me for a wrist and hand and neck problem, Jim. And Luke, when I adjusted her and did my exam, I also found her jaw was out of place. And when I corrected her jaw, she said to her daughter and son in the room, she said, come over here. They said, what? She said, I can hear. I've been 7 years deaf in my right ear. We've had people had amazing miracles beyond the Harvey Lillard story, as you know, the very foundation of chiropractic when Dr. Palmer adjusted a janitor and restored his hearing. So we've had wonderful miracles, and all the listening audience of doctors and students are probably going to, if they already haven't had, opportunity to see amazing successes, just like chicken soup for the chiropractic soul. So I know that you guys understand that. If those want to learn about our fellowship program, they can go to training.drmitchmally.com. If you want to know a schedule, which does change quite often, you can go to schedule.drmitchmally.com. Find out where I'm at. If you have anything you need to say or comment, you can always email me at mrmally@live.com. Mr. Mally at live.com. I'm here to serve. Our office number is 563-823-5555. 563-823-5555. Select 0. And I hope to meet you all one day. Look forward to it. And I thank you so much for this opportunity to share my life and learn more about both of your lives.
Thank you so much.
Absolutely, Dr. Mitch. It's been a pleasure. Jim and I would love to do more work with you in the future. And Brandy Morgan also says she wants you back on the show. So everything's good.
Is Brandy one of my staff members or just an audience participant there? That's awesome.
Actually, she's a staff member in New York with Dr. Tim Schaub at Schaub Chiropractic.
Oh, Dr. Tim Schaub knows me very well. Chiro Sushi.
Yes, sir.
It's coming up.
Yep, he has been to my courses. He's had me treat him, and you could talk to him about that as well. What a wonderful man, and thank you, Brandy Morgan, as well. I hope there was more than one person on this call, and I hope I reached into your heart, into your soul, and I hope that your years to come are filled with a 100-year lifestyle.
Thank you for being our guest, and we want you to enjoy the rest of your evening.
Thank you. Will do.
Dr. Mitch. We'll talk soon, okay?
God bless, guys.
All right,
Thank
have
you.
a good night.
Bye.
You too. Bye-bye.
Thanks for listening to Chiro Hustle. Don't forget to subscribe and check back next week to continue hustling.